For this video skill, I'm going to show you how to dangle your resident, having them sit on the side of the bed, how to properly put on a gait belt on your resident, and also how to ambulate or walk with your resident. The first thing that you need to make sure that you do for this is that you do want their shoes to be on in bed before you move them to the side of the bed. When you move a person to the side of the bed, it just becomes kind of cumbersome to get down here and put their shoes on. So you want them on in bed before you even get them up. The next thing that you want to do is to raise the head of the bed up some. You could raise it up a little more than this or a little less than this, depending on your resident. When you dangle somebody, you're going to do the ballerina twirl. So you're going to have this arm underneath their shoulders here, this arm underneath their thighs here, and you're going to hold them. On the count of 3, you'll turn them, and you'll just basically move your body, and they will turn to the side of the bed. You want to make sure you do this in a slow motion, but you want to make sure that you do it continuously. You don't want to stop halfway through. You want to bring their legs all the way to the side of the bed. Then you'll stand in front of them just to kind of help them get their bearings. The main reason of doing this is so that you don't just take them from a lying position to a sitting position really fast so that they don't get dizzy and black out. So for this skill, we've been talking a lot about raising the bed up. I don't want the bed up too high in this skill, only because of the fact that if he's way high in the air and he gets to the side of the bed, he can just fall out, and that's a safety issue. The other thing that I want to make sure of is I have my other supplies ready and within reach. So I have the walker right here, and I have my gait belt right within reach. All right, sir, we're going to sit on the side of the bed, okay? So I'm going to have you put your hands, you can put your hands there on the bed. I'm going to have you lean forward just a little bit for my hand here, my hand here. On the count of 3, we're going to sit on the side of the bed, okay? 1, 2, and 3. All right. So his feet are flat on the floor. You can just sit there for a minute, and I'm going to put your gait belt on. The gait belts have an area here that have like teeth with a little flap. When you put the gait belt on, you want to make sure that the belt part comes underneath and comes through that, kind of like a tongue sticking out of a mouth with the teeth. So that's how you're going to attach it. Once it's tight enough, you'll put it through the other latch. And you'll be able to do this in lab. You'll also do this on clinical. So I'm going to wrap this around without hitting him in the head. I'm going to wrap this around him, and I'm going to have you pick your arms up. Sometimes your residents will be able to pick up their arms. Sometimes you'll have to put it underneath their arms. You want to make sure that this is tight enough that it's not going to have slack on it when he stands up. So, whoops. I missed the tongue. There we go. The teeth part kind of catch and kind of keep it in the place that you want it while you loop the other side. This extra then, you just want to loop it into the side of the belt just so it doesn't dangle down, especially if you're taking him to the bathroom. Now, before I stand him up, his care plan is to ambulate with a walker. So I have his walker here, and I'm going to put that right in front of him before he stands up. When residents stand up, especially when they have a walker in front of them, they have a tendency of reaching out and grabbing onto the walker to stand up. That is more difficult for them to do if you're standing and you're trying to push off of something up here. So you always want to encourage the resident to push off of the bed with their hands and then stand up and grab onto the walker. I have a little bit longer limbs, so I'm able to kind of put my foot in front here and grab onto the gait belt. If you are unable to, just kind of have one foot at least so you kind of prevent their feet from sliding, and then grab onto the gait belt with 2 hands always on the gait belt. We're going to stand up now for a second, okay? All right, on the count of 3, 1, 2, and 3 up. And hold on to your walker. And at this point, we're going to go ahead and we're going to wait here for about 10 seconds, because if he gets dizzy or lightheaded, the first thing we're going to do is sit right back down. Once we've waited and you keep your eye on the resident, then you can go ahead and start when he's ready. Are you ready to walk? Yeah. All right. So we're going to walk with the resident. We're going to have 2 hands on that gait belt, and we're going to walk next to him. We're going to be able to see his face in case he gets lightheaded or pale or sweaty. So we're going to take a walk here. We'll be out of the camera view for just a second, and we'll turn around and walk back. for the skills competency test, you do have to walk at least 10 feet. So keep that in mind when you're preparing for the skills test. I'm going to go ahead and turn. Okay, and back up. Now, before he sits down, a tip for you in the nursing home setting. When you have somebody sit down in bed, you want to make sure that they sit towards the head of the bed. If he sits down here, you're going to have to boost him. So if you could take a step towards the head of the bed. Well, one more step, please. All right, and go ahead and have a seat. This way, when you lay him down in bed, he's going to be in the right position. So that's just one thing you're gonna learn that with experience during clinical. So I take off the gait belt before I lay him down, and then you can lay him down, just reverse ballerina twirl. All right, so we're gonna lay down in bed now on the count of 3, 1, 2, and 3, and up in bed, he's comfortable. All right, and that's the conclusion of this skills video.